Yeah.
What were the initial steps in terms of planning for your treatment?
It was determined that we were going to need to have chemotherapy, and one or two options were put as to what we were going to need.
Yeah. You had the initial chemotherapy before surgery then?
The chemotherapy went before the surgery to reduce the size of the tumour.
Yes, the tumour load. And how successful was that in your case?
In my case, it was very good. I think actually we may well have caught it in the early days.
Yeah.
There are, I think, I'm told that there are 4 stages in the development of cancer, and stage 1 is rarely seen. Stage 2 is a little bit more common, and I think I was at stage 2, so it's quite an early stage in its development.
Did they give you that information later based on
that came a little bit later on? Yes,
that had come back after testing. Yeah,
that's right.
So you had the chemotherapy. How long was that process roughly for?
That lasted for about a month or thereabouts, a little bit longer perhaps.
And when was this compared to where we are now?
That was in June and July of 2010.
Okay. So roughly 3 years ago.
Yes.
Yeah.
Yeah.
Okay. And you mentioned there, but how successful was the chemotherapy for you in terms of shrinking that tumour?
It seemed to shrink it quite well. The chemotherapy wasn't particularly nice. I don't think everybody experiences the different stages and
side effects
and so forth.
Did you have any particular problems yourself that you stick in your mind?
Yes, there was 2 cycles. The second cycle, I was quite sick. And it did affect me quite a bit.
Yeah.
I'm not very good when I'm sick, but.
Did you have the chemotherapy that meant you had to come into the chemotherapy suite? Or you had the one that you took home?
It meant that I had to come in for 1 day, and then we went home with an attachment in the PICC line. Which drip fed in for the 4 week.
Right. Okay. And what was the next step then?
The next stage, they determined after that we were going to have an operation to take out the cancerous part of the esophagus.
And I know from previous experience that often the operation for the esophageal cancer can be quite complex and in-depth.
It is a very complex operation, and 9.5 hours I think mine was, and done in 2 stages, where they had to reduce the stomach size in the morning part of the operation. In the afternoon part, they have to go in through the ribs on one side, deflate the lung to get at the esophagus, take out the affected part, and then rejoin up the reduced stomach size to what's left of the esophagus. So it's quite a complex operation, and you know a little bit about it for a few days afterwards, or even longer.
Well, in fact, you often go to ITU for the 2 or 3 days, don't you, as an automatic check?
Yes.
And did that happen in your case?
Yes, it did, yes.
And what was the recovery period like on the ward subsequent to that?
It was actually good, and the hospital, Leicester Hospital, was very good in helping out. I don't have any complaints at all with the treatment that we had. It was excellent.
How did you find the degree to which you were encouraged to get up, mobilise, start walking again?
Actually, they were very quick coming round to get you to walk. In fact, the very first day in ITU, I was asked if I'd like to sit out in a chair, and although it took a lot of effort from their point of view in manoeuvring all the tubes and the bottles and the drains and things like that, they found it beneficial that I did it, and I did do it, and I sat out for 2 hours.
Usually when you give yourself a bit of a push as well as them encouraging you, the combination gets you up and moving more quickly than if you just waited for the day you were feeling better.
Yeah, I think that's true.
Yeah. How long were you in hospital in that rehabilitation phase, or the recovery phase I should call it?
I think I was in, mind plays tricks with you after a while. I think I was in there for about 2 to 3 weeks.
Yeah, that sounds about right. And what was it like to finally get home?
Lovely. But hard work. There was a big learning curve once you got home to learn how to cope with the various types of foods and what you'd undergone. And I think you had to learn how to deal with your own body. If you were tired, you went to lay down. If you were fit, you went and did something, perhaps for argument's sake, out in the garden.
So in other words, you were taking feedback from how you felt, and
Yes.
then you would capitalise upon it if you could.
Yes.
But if you needed to rest, you would as well.
I think that's very true.
Yeah.
You've got to learn how to cope with these things. Yeah.